It is 9:23. We have some exciting news to share going down here in the capital city. Hartford HealthCare's Headache Center has been given a huge new grant to do some cutting-edge research on a specific type of severe, long-lasting migraines. Joining me this morning to talk about this first-of-its-kind research coming up is one of the award recipients, Dr. Grosberg. He's the medical director of the headache program there for Hartford HealthCare, and a pleasure to meet you, sir.
A pleasure. Thank you very much for having me.
Yes, and boy, you are really excited about this grant. You were just talking to me about it before. Why is it so exciting for you?
So this is one of the most exciting studies that's happening in the field of headache, and the reason why is we are trying to take the guesswork out of figuring out which acute treatments work for people who suffer from migraine that lasts 3 or more days, what's known as status migrainosus. Okay. This complication of migraine often leads these severe migraine sufferers to go to urgent care, emergency room visits. So this study, which is awarded by the Migraine Research Foundation, is the first of its kind ever. It's a multi-year award that's being done at the Hartford HealthCare Headache Center in collaboration with one of our colleagues at Harvard Medical School to study people who have these prolonged bouts of migraine that last 3 or more days.
How big of a grant is this?
This is $250,000. It's the first ever that they've done like this before.
So what is this going to enable you to do with this study? I mean, would you have done just a sort of a smaller version of this study and now you can expand the scope? Was this sort of thing just not at all possible before the grant?
This is the first study of its kind anywhere in the world. Okay. So we beat out researchers all over the world to study prolonged bouts of migraine. And currently what's done is headache specialists, neurologists, other providers who take care of patients with headache, they use clinical experience, they use evidence-based medicine, but ultimately when they see a person who's coming in for headache, they don't know which treatment is going to work for that individual patient. Yeah. We're looking to take that trial and error approach out of the equation. So what we're going to do is we're going to study patients who have prolonged bouts of migraine 3 or more days, and we're going to differentiate people who respond to certain types of treatments versus those that don't, and then figure out which attributes come into play so that we eliminate the trial and error approach. We can end up saying, based on A, B, C, and D, this is the reasons why you're going to respond to this treatment. Right. It's never been done before.
Now, this may be a stupid question. Do you know what types of attributes you're looking for? Is it the particular cause of each person? Are there different causes for status migrainosus?
So it may end up being the fact that somebody has nausea. It may be the fact that somebody has severe sensitivity when they have migraine, what's known as allodynia. Yeah. It may be any number of factors, and we're going to be doing very sophisticated not only histories, but diagnostic testing as well.
How do you study? I mean, you can't just will a migraine to happen. How do you wind up getting the patients in and getting them in such a controlled setting when you don't know when a migraine is going to necessarily happen?
So what we're doing is we're having patients keep headache diaries or logs to keep track of the frequency of their headaches and as well as the duration, how long the headaches last. And then when they come in and they have a migraine that's lasting 3 or more days, that's when we're going to study them as well. So before they have that prolonged migraine and then during that prolonged migraine.
How much different is a 3-day long, a status migrainosus headache, than a regular headache, or just even a lesser lasting migraine?
So migraine typically lasts anywhere from 4 to 72 hours, right? Either treated or untreated. But prolonged bouts of migraine, status migrainosus, is one of the main reasons why people seek care in emergency departments. These are people who are completely debilitated.
Yeah, I can only imagine.
Oh, it's awful. Yeah. And so therefore this treatment plan should end up having implications for millions of migraine sufferers worldwide. I'm very excited that this is happening at the Hartford HealthCare Headache Center. I'm very happy that this is happening in Connecticut. My colleague from Harvard is actually coming down over the next 3 years for this study.
Real quick, unfortunately, because we're out of time. If somebody out there is saying, hey, that's me, can I be a part of this study? Can they? Or
Absolutely.
What do they need to do?
They just have to end up calling the Hartford HealthCare Headache Center or email us. It's on the website. And let us know that they're interested in participating in this study.
There you go. Dr. Grosberg would love to hear from you folks. I can only imagine how debilitating that is. I know if I get a simple sinus headache, I'm out for the day. So thank you so much.
Thank you so much.
It's great news. Glad to have you here. Let us know how it goes when it's done.
I definitely will.
All right. Thank you so much.